Okay, sir.
You can start now.
Hello, everyone. My name is Esther. Today I'll be taking class on Foundation of Nursing. I have picked out some questions which we will be solving together. And this question will be important for the upcoming examination. Okay. So let's see. For the first question, we have antidote for heparin. So the option we have here are A, vitamin K, then we have protamine sulfate, then we have aminocaproic acid, then we have amiodarone. Okay, so which will be the right answer? Okay, the right answer for this question is protamine. Okay. And this protamine, they are highly basic in nature, and this heparin, they are highly acidic in nature. Okay, so these protamine, they are positively charged, and then this heparin are strong negatively charged. Okay, what happens is that when you give protamine sulfate for sulfate, introduce protamine sulfate, they form a complex. Okay, so complex, and we have vitamin K. This vitamin K is given mainly for warfarin. Okay, then we have aminocaproic acid. This aminocaproic acid, they are antidote for thrombolytic acid. Okay, thrombolytic acid. Then we have amiodarone. Okay, this amiodarone are mainly given in ventricular tachycardia and fibrillation. Okay. Okay, so we have learned today that antidotes for heparin is protamine sulfate. Going to the next question, we have intradermal injection is given at a angle of. So when we give any kind of intradermal injection, at which degree we wish to give in this one intradermal? Okay, first we have 15 degree, then we have 45 degree, then we have 25 degree, and we have 90 degree. Which is the right answer? So here the right answer is 15 degree. Okay. So intradermal injection, it can be given between 10 to 15 degree. Then for 45 degree, what we have subcutaneous injection, and then 25 degree we have IV injection, and for 90 degree we have IM injection. Okay. So intradermal injection is given at 15 degree. Okay. Next we have, which value of nursing practices refers to the act of selfless concern of a nurse for the well-being of a patient without getting a reward? Okay. First, we have A, autonomy. B, we have empathy. C, we have altruism. D, we have compassion. Okay. So which one will be the answer for here? So the answer for which value of nursing practice refer to the act of selfless concern of a nurse for the well-being of a patient is altruism. Okay. So this is the right answer. When we say autonomy, that means you have respect for the patient to take a decision. Okay. Respect of the self-determination, self-determination of the patients. Okay. And when we say empathy, that means you are understanding, you are understanding and sharing the feeling of the patients. Okay. And when we say compassionate, it's a deeper response of a suffering of a patient, which is a combination of empathy, emotions. Okay. And then you get motivated to elevate the pain of a patient. Deeper respond to suffering. Okay. Okay, going to the next questions, we have a patient who is unresponsive situation is reported to the emergency triad with unknown history. Okay, on assessment, it is found respiration are deep and rapid. ABC value are pH 7.2, PaCO2 is 21, and PaO2 is 92, and bicarbonate is 8. Okay, you interpret this value to indicate. So first thing, when you see this in ABC analysis, first thing we have to see is we have to know is the normal value. Okay, let's see the normal value. Normal value of the pH degree, and the pH is 7.35 to 7.45. Okay, then we have HCO3, we have 22 to 26. Then we have PaCO2 is between 35 to 45. Then we have PaO2 from 80 to 100. Okay, so next thing first we have to see is whether it's acidic or alkaline in nature. Okay, alkalosis. First we have to see the pH. Okay, we have already known that 7.35 is the normal value to 7.45. Okay, so the value here we got is 7.5. So 7.5 is lesser than 7.35, which means acidic. Okay, and we have, so the right answer will be either B or C. Okay, so let's find out whether it's metabolic or respiratory. Okay, so in order to know the whether it's metabolic or is it respiratory, you have to know one thing is ROME. Okay, ROME, respiratory, opposite, then metabolic, equal. Okay, in seeing here in the we have partial carbon dioxide is 21. Okay, so in partial, if PaCO2 is 21, that means it's going down. Okay, normal range is 35 to 45. Then we have metabolic equal. Here in metabolic we have seen uh, bicarbonate. Okay, bicarbonate is 8, it's going down. Okay, normal range is 22 to 26. So here what we can know is that the pH and the PaCO2 is going in the same direction, and then the pH and this one carbonate also going in the same direction. Okay, so here we can conclude that it is of metabolic acidosis. Okay, the right answer will be B. I hope you understand. If you have any doubt, we can discuss in next class again. Okay, going to the next question, we have, what is an example of an objective data? Okay, so in assessment we used to have two data, right? One is subjective data and we have objective data. Okay, see, when we say objective data, it is the sign. Okay, and when we say subjective data, it's mainly of the symptom. Okay, so objective data are measurable and they are over data, or your subjective data, it can be because the patient's verbalization, it can be of just a feeling or perception of a patient. So going to A, let's see what will be the answer. A is feeling of worry. Then we have C, itching. Then we have discoloration of the skin and nausea. So seeing this feeling of worry, it's like it's a feeling of a patient, right? Then itching, there are only symptoms, and then discoloration of the skin, it can be measurable, right? So among this thing, and nausea also as part of example of feeling again, right? So the right answer for this question will be number B, discoloration of the skin. Okay, objective data. Okay, going to the next question, we have, how will the nurse record smoking history on a patient who has smoked 2.5 pack of cigarette per day for 10 years? So what will be the answer? How will the nurse record smoking history of a patient who has smoked 2.5 pack of cigarette per day for 10 years? So we have a formula for this. Take here equal to number of pack smoke per day per day into number of year, number of smoke year. Okay, the year how long the patient have smoked. Okay, so equal to number of pack smoke per day is equal to 22.5, right? 2.5 then into 10 years. Okay, then it will come 25. Okay, so among here the right answer will be D. Patient has smoked 25 pack years smoking history. Okay, going to the next question, we have the nurse in charge measure a patient temperature at 102 Fahrenheit. What is the equivalent centigrade temperature? Okay, the nurse in charge measure a patient temperature at 102 Fahrenheit. What is the equivalent centigrade temperature? Number A, we have 39 degree, and C, we have 38.9. Then B, we have 49 degree, and D, we have 48.1 degree. What is the right answer? So here, in order to convert from Fahrenheit to Celsius, we have a formula. Let's see the formula. We have Celsius equal to Fahrenheit minus 32 into 5 by 9. Okay, so we have Fahrenheit is 102 minus 32 into 5 by 9. So 100 minus 32 will get 70, right? So when we divided 5 divided by 9 will get around 0.5, then 5,556, right? Okay, so 0.556. So when we multiply it 70 to 0.556, we'll get around 38.9 degree. Okay, 38.92 degree. So here the right answer will be C, 38.9 degree. Okay, next question we have the types of fever in which the temperature fluctuates more than 2 degrees Celsius, all above normal during a 24 hours period is we have intermittent fever, B, we have remittent fever, C, we have inverse fever, and D, we have relapsing fever. So which one is the correct answer? The types of fever in which the temperature fluctuates more than 2 degrees Celsius, all above normal during 24 hours period. Which one is the correct answer? So when we say intermittent fever, it means like the person will be having a fever, high fever around 100 or 103, then it will come to around 104, then it will go back to 102, then it will come 98, then it will go to 97.5. Okay, so then it will come back to fever. That means when you say intermittent fever, in per day the person will have high fever also, then there will be episode of normal fever also, then it will go to high fever. That is called intermittent fever. Okay, but when you say remittent fever, it means that the person will have a high temperature. Okay, like 100.5, 105, then it will go down to 103, then it might goes down to 101, then you will go up to 103 again, 105. Okay, it will always be high. There will be a fluctuation of more than 2 degrees. There might be a fluctuation. However, you will never touch the normal baseline. Okay, that is called remittent fever. Then when we say inverse fever, normally our body temperature, what happens is that in the morning our body temperature drops to the lowest, and in the evening it has to be at the highest. However, in inverse fever, what happens is that instead of our body becoming the like minimum at in the morning, it becomes the hottest in the there will be fever in the morning, and in the evening there will be no fever. That is called inverse fever. Okay, When we say relapsing fever, again, this relapsing fever, what happened is, suppose if a person like have fever like 1 or 2 days, then there will be a period of like 1 or 2 days, the patient will be in febrile state. Then after 2 or 3 days, the person will started having fever. This is called relapsing fever. Okay, so among this, after knowing the definition of what is the meaning, the most answered according to the answer, right answer will be remittent fever. Okay, I hope till now it's clear. Going to the nine answer, what is the normal oral temperature of an adult? What is the normal oral temperature of an adult? So the norm, we have A 90 Fahrenheit, we have B 98.6, we have C 91.5 Fahrenheit, and we have D 90.6 Fahrenheit. Okay, so the right answer is B. Okay, B is the right answer, 98.6 Fahrenheit, or it can be 37 degree. Okay, and one thing we have to remember is that what taking temperature, the lowest is from the axilla, and then we have the oral temperature and we have the rectal temperature. Okay, we have oral temperature and we have the rectal. Okay, the axilla normal temperature is 97.6, then we have 98.6 Fahrenheit, then we have 99.6 Fahrenheit. In Celsius, we have 36.5 degrees Celsius, and then 37 degrees Celsius, and we have 37.5 degrees Celsius. Okay, saying the normal range, we came to know that axilla, it's always 1 Fahrenheit, 1 Fahrenheit lower than the oral temperature, and then 0.5 Celsius lower than the it's lower than the axilla temperature, and this oral temperature is always 1 degree higher, 1 degree higher than the rectal lower rectal temperature is 1 degree higher, 1 degree Fahrenheit higher than the oral temperature, and 0.5 degree higher than the oral temperature. Okay, the differences. Going to the next topic, question we have, a clinical thermometer indicates temperature in degree Fahrenheit from, in a clinical thermometer indicates temperature in degree Fahrenheit from 94 to 108, 94 to 110, 96 to 108, 98 to 110. Which one is the right answer? A clinical thermometer indicates temperature in degree Fahrenheit from 34 to 108, 34 to 110, 96 to 108, and 96 to 110. So here the right answer is number 8. Okay. A 94 to 108. It's from 35 degrees Celsius to 42 degrees Celsius. Okay. Yes. Okay, next question we have. If a patient's blood pressure is 160 by 96, his blood pressure is A 64, we have B 96, C 160, and 2 B 256. Okay, if a patient blood pressure is 160 by 96, his pulse pressure is 64, B 96, C 160, and D 256. Which is the right answer? Okay, so in order to get the pulse pressure, we have a formula. Okay, so the formula for this pulse pressure is systolic minus diastolic. Okay, so we have 160 minus 96, we get 64. Okay, so the right answer will be A. So what is the significance for this pulse pressure is that uh, The normal range, let's see the normal range. It ranges from 30 to 50. In some textbook, it shows 40 to 60. Okay. So what the significance is that uh, it shows suppose if there is more than 60, if the pulse pressure is more than 60, it shows that if it's more than 60, it shows that uh, the heart has to pump like there is like it shows that there is the hardening of blood pressure of the blood vessels. Okay, and if it's lower, then it shows that the heart is not pumping enough blood in the system. Okay, next question we have: which of the following is useful for assessing the pain in children? Which of the following is used for assessing the pain in children? One is verbal descriptor scale, B is numerical rating scale, C is visual analog scale, and D we have Wong-Becker's face pain rating scale. Okay, so among this, which is rating scale which is used in the children? So the right answer is D. Okay, Wong-Becker face pain rating scale is mainly used in children. Okay. Going to the next question. The nurse is charged is assessing a patient abdomen. Which examination technique should be the nurse use first? A. Auscultation, B. Palpation, C. Percussion, D. Inspection. The nurse in charge is assessing a patient abdomen. Which examination technique should the nurse use first? Number A is auscultation, B is palpation, C. Percussion, and D is inspection. See, we have learned that in physical examination, it's always inspection, then palpation, percussion, and we have auscultation. However, in case of abdomen, it's changed. Okay, in the abdomen examination, we have inspection, we have auscultation, then we have percussion, then palpation. Okay. Here the question is that the nurse in charge is assessing a patient abdomen. Which examination technique should the nurse use first? That means here the answer will be D. Okay, D inspection. In the abdomen case here, after inspection, the nurse should auscultate, should do auscultation, then percussion, then palpation. The main reason is that if suppose if the nurses have done the palpation or percussion first, what happens is that there can be increase in peristalsis movement, and there can be that there can be a change in the frequency and pitch or a pitch of the abdomen. Okay, so there can be extra sound which can come out. So it's so in case of abdomen examination, it should be always inspection, auscultation, percussion, and palpation. Okay. Going to the next question, we have medical asepsis differ from surgical asepsis is that it is aimed at prevents first option is A, preventing transmission of microorganism, B is preventing entry of microorganism into the body, C is sterilizing of all equipment, D is killing of all microorganism. Okay. Medical asepsis differ from surgical asepsis in that it is aimed at preventing transmission of microorganism and preventing entry of microorganism into the body, sterilization of all equipment, killing of all microorganism. So which will be the right answer? So we have known that in medical asepsis, like we try to reduce the number of microorganism, and we try to prevent the transfer of microorganisms, right? Seeing the number A is mostly the right answer. Seeing B and C and D, if C, preventing entry of microorganism and sterilizing all equipment, killing all microorganisms, it comes under sterilization, okay? Surgical asepsis, okay? Going to the next, we have what is the first and primary step in the stage of infections? Stages of infection. What is the primary and what is the first and primary stage in the steps in the stages of infection? A, we have reservoir host. B, we have porter of exit. C, we have infectious agent. D, we have porter of entry. Which is the right answer? In the stages of infection, we have still 6 steps, right? First is infectious agents. Then we have porter of exit. Next we have reservoir. Source. Then we have 2, 3, porter of exit. Then we have mode of transmission. Then fifth we have we have porter of entry. Then we have susceptible host. Okay, here we can see. So what is the first step and primary step in the stage of infection will be C. Okay, infectious agent. This is the rightful answer. Going to the next question, we have if a human being acts as a reservoir in the face of chain of infection, he or she will be referred to as number A is host, B is carrier, C is transporter, and D is agent. Here the right answer will be B, okay, carrier, okay. So when we say host, that means the person who is being infected with infectious agent or the person who is carrying the disease. When we say carrier, it means that the person is infected with being infected. However, it may show signs, it can show a symptom or it may not have any symptom, and they can carry from one place to another. And when we say transporter, they are like they are the one who, they are not being infected with they are not being infected. However, they can they can transport. Okay, when then when we say agent, it means they are the entity which can cause the diseases. It's called agent. Okay, going to the next question, we have in the stage of infection, what will refer to the period between a period to a person get infected with a microorganism and the appearance of first sign and symptom related to that condition. In the stage of infection, what will refer to the period between a person get infected with a microorganism and the appearance of first sign and symptom related to that period condition. We have a prodromal stage, we have incubation period, we have convalescence period, D, we have clinical stage. Which is the right answer? So coming to the 17, we have already learned that uh, according to the question, B is the right answer. Okay, when we say for prodromal stage, prodromal stage, it's the second stage. Okay, it's at the second stage where the sign and symptom start appear in a mild form. Okay, when we say convalescence period, it's a period the person have already recovered. Okay, and when we say clinical stage, uh, this clinical stage it's like it's here the sign and symptom which is specific to the disease started appearing. Okay, this is called clinical stage. Going to the next question. The best way to decrease the risk of transferring pathogen to a patient when removing contaminated glove is number A. Wash the glove before removing them. B. Gently pull on the finger of the glove when removing them. C. Gently pull down the cuff and invert the glove when removing them. And removing the glove, then turn the inside out. Okay, which one is the right answer? The best way to decrease the risk of transferring pathogen to a patient when removing contaminated glove is A. Wash the glove before removing them. B. Gently pull on the finger of the glove when removing them. C. We have gently pull just below the glove and invert the glove when removing them. D. Remove the glove and then turn the inside out. So here the right answer will be B. Okay. BC, okay. Gently pull down below the cuff and invert the glove when removing them, okay. Next question we have, the nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precaution. Which personal protective equipment will she wear to deliver the meal tray? The nurse is assigned to a patient who has a bacterial pneumonia and is under droplet precaution. Which personal protective equipment will she wear to deliver the meal tray? Number A, no PPE required. B, only mask is needed. C, special filtration mask and glove. D, gown, mask, glove, shoe cover. So here we have uh, here the only B is needed, okay? For droplet precaution, only mask is needed, okay? Next, we have the most appropriate time to the nurse to obtain a sputum specimen for culture is A. Early in the morning. B. The patient eats a light breakfast. Then C. After aerosol therapy. And D. After chest physiotherapy. The most appropriate time for the nurse to obtain a sputum specimen for culture is A. Early in the morning. B. After the patient eats a light breakfast. C. After aerosol therapy. Then D. We have after chest therapy. So here the right answer is A, okay, early in the morning. The reason is that throughout the night, the sputum will be collected, and then it's the best for sending for sputum specimen. Okay. Then after eating a light breakfast, so what happens is after eating a light breakfast, it can be mixed with food particles and the sputum. Okay. Okay. For today we can discuss this much 20 MCQ. See you on next class. Okay.